The question of the use of big data in healthcare is, and whether it's new or whether it's been a long time coming, is really interesting. I think it's actually not new. It's been used for many years, probably 20 years or so. Analyses of claims data to look at health outcomes of patients treated with different drugs or medical technologies. I think the way it's being used is shifting quite a bit, however, and the nature of the data is changing. So rather than narrow slices of data like claims information, we're now starting to analyze electronic health record data. We're linking claims data to electronic health record data. And now new kinds of data like consumer information are entering in. Optum Labs is using big data in a variety of different ways. Sort of our foundational platform is to use big data for research, because we're very interested in generating more evidence around patient outcomes associated with different medical technologies, different payment systems, how care is organized, and so forth. And those are intended all to enter into the peer-reviewed research literature. But that's really only the first step. We're interested in also using the data to work with our clinical partners to be able to take results that we're finding from the research studies and actually implement them in translation exercises to shorten the translation cycle from currently 17 years to as fast as we can shorten it. And then ultimately to use data to help to develop new tools, whether they're physician desktop tools or new care models to help improve the efficiency and delivery of care to patients, but most importantly to improve patient outcomes. There are a variety of challenges in analyzing big data and knowing whether you have the right answer or not. One of the things that comes up right away is when the results from observational data differ from clinical trials. And there's all kinds of reasons why results may differ in observational data from clinical trials, which are generally conducted on special populations. They're rather short in duration. They are typically small in sample size. And so the groups of patients that are actually treated in the general population are quite different than the patients that are reflected in clinical trials. And as a result, you'd expect the results to be different. The different stakeholders are partnering and working with big data in a variety of ways. Our academic partners in Optum Labs, for example, are mainly interested in doing research and conducting outcomes research and health economic research and epidemiological research and so forth. The provider organizations, on the other hand, are interested mainly in translation. They're not so much interested in research, but except for the results from the research and how it can be translated into clinical practice. And then there are groups like the Mayo Clinic, for example, that have very, very sophisticated research groups. And they are working not only with healthcare on the outcomes research side and the clinical translation side, but also in terms of efficiency and delivery of care and operations. So they're using very sophisticated methods from operations research, for example, to maximize delivery systems and the like.